Hello, my name is Dr. Stanley Lango, and I'll welcome you to this broadcast. And today I'd like to talk to you about a controversy that is becoming more of a controversy as time goes by, and that is the whole issue of whether patients should take statin drugs and who should take statin drugs. On the one end of the spectrum, you have a fairly aggressive medical community, pharmaceutical community that is broadening the indications for people that supposedly should be on statin drugs. On the other end of the spectrum, you have a lot of patients who are very interested in taking responsibility for their lives, and they're a little bit distrusting about some of the advice that they get about whether people should be on statin drugs or not. So I'd like to share with you a story of a patient that I met recently, and this person came to me as a new patient from out of state. So one of the questions that he had was whether he should continue the statin drug that he had stopped about 4 months before. And the reason that he was uncertain about whether he should continue it is that he'd been doing his own reading, and he did not want to stay on the statin if he didn't really need to, because he'd started to get some muscle aching. And like most people, who wants to hurt when you don't need to? So I went back over his original labs that had been used to decide that he should be on a statin drug. And I was shocked that he had numbers that were so good that most people would be happy with where his numbers were before he started the statin drug. They'd have been happy with that as a result of being on the statin drug. In other words, where his starting point was better than a lot of people's treatment points. And yet whoever had seen him had made the decision that he needed to be on a statin drug, to take this drug for the rest of his life for an indication that was non-existent, which was that he was supposedly at a higher risk of coronary disease. There were so many things that were not fitting with his cholesterol profile. He had an excellent HDL level. His so-called bad cholesterol was not even elevated. And there are some other features that I won't bore you with. But the point being that a lot of people get slapped on statins because of a increased risk of coronary disease, but they don't have any symptoms at all. They don't have any disease. They just have increased risk that's been calculated. Now, doctors use the phrase primary prevention to describe that strategy. I'm not going to bore you with the details, but there are two opposing points of view. One would say that very few people benefit from primary prevention. On the other hand, is an aggressive strategy that is reaching the point that almost 40% of the population would qualify to be on a statin drug to prevent heart attacks. Now, the problem with these kind of primary prevention statistics is that when you look at death rates of people, all-cause mortality, we say, so doesn't look at all of the different reasons, just that when did people die, whether they were on statins or whether they weren't. And for primary prevention, there isn't any difference. All-cause mortality is the same. In other words, you don't live any longer by taking a statin drug. You might have a lower heart attack rate, but you're going to die from something else that hasn't been figured out yet, I might add, based on the current research. So the point is that if you're considering being on a statin drug because you have increased risk factors based on cholesterol and other things because of some formula that the doctor is using, ask for some specific numbers as far as what actually is the chance of me having a heart attack if I do take the statin drug, and what is the chance that I don't have a heart attack, and what is the chance that I have a heart attack if I just keep doing what I'm doing, and what is the chance that I have a heart attack if I change my lifestyle dramatically, don't take the statin drug, but start eating very, very carefully, and I exercise a lot every day. So that last little question was sort of put there on purpose because nobody's tested that. These statin drugs are being given out for primary prevention, and they've never been tested against what a healthy lifestyle looks like. So we don't even know from good studies which one works better. And we don't even know that the statin is complementary to a really, really healthy lifestyle. Now, secondary prevention, which is where you're using the statin drug for somebody that has known disease, that's a completely different issue, and I'm not addressing that here. And I'm not suggesting that if you have disease that you should stop your statin drug or anything like that. I'm talking about primary prevention when the risk factors are sometimes not so clear. And I'm just wanting you to be aware that there is a lot of pressure from certain sources to broaden that category of people that supposedly should be on a statin drug when the benefit isn't so clear yet, especially when you look at two things: all-cause mortality rates not being significantly different, and number two, significantly increased diabetes as a complication of being on a statin drug. And there are some other ones that I won't talk about at this point. Save that for a later date. But the point is that make an informed decision. I'm not saying that you shouldn't take a statin for primary prevention. What I'm saying is you should make an informed decision. This patient that I saw, he didn't have the slightest idea what his risk was, and his risk was lower than the average person walking around by far if you just looked at his cholesterol levels. And his lifestyle was healthy to boot. So he clearly was denied an informed decision, has been taking this drug for years, and finally stopped it on his own because he was hurting. So make an informed decision. Ask the doctor for specific statistics, not what percent of improvement, but numbers, actual numbers that, what are the numbers difference between this and that? What's the numbers of heart attacks if I treat, if I don't treat? Not percent improvement, because those numbers sound a whole lot better than the real numbers actually are. So I hope you've found this helpful today. I'm not trying to undermine anybody's decision to use statins, and by no means am I attempting to do that. What I am attempting to do is to encourage you to make informed decisions and to be proactive in asking good questions so that you're well informed. And so when you decide to take a medication that you're going to take for the rest of your life, that you have a really good reason to do that when you run into complications or side effects. So I wish you well, God bless, and have a good day.